The second trimester of pregnancy. A comprehensive overview. The second trimester of pregnancy, often considered the honeymoon period, spans from week 13 to week 27. Many women find this stage more comfortable as the symptoms of the first trimester, such as morning sickness and fatigue, tend to subside. However, it is important to remember that every pregnancy is different and some individuals may continue to experience symptoms or develop new ones. Changes in the mother's body. During the second trimester, a woman's body undergoes several noticeable changes. 1. Baby bump. The uterus continues to expand to accommodate the growing fetus, leading to a visible baby bump. 1. The uterus grows from the size of a pear to the size of a watermelon. 2. Weight gain. Weight gain typically begins to occur after the 5th month, with an average increase of about 2 to 2.5 kgs per month. 3. Breast changes. Breasts may increase in size and sensitivity. 3. The areola may become darker and larger, and stretch marks may appear. 4. Skin changes. Chloasma. Some women experience darkening or brownish pigmentation on the face, known as chloasma or the mask of pregnancy. Linea nigra. A dark vertical line may appear from the navel to the hairline, called linea nigra. Stretch marks. Stretch marks may appear on the belly, breasts, buttocks, and thighs due to the stretching of the skin. 5. Increased appetite. Many women experience an increase in appetite as their nausea fades. 6. Other common discomforts. Swollen gums. Gums may become swollen and prone to bleeding due to increased blood flow. Nasal congestion and nosebleeds. Increased blood volume and hormones can cause nasal congestion and nosebleeds. Leg cramps. Leg cramps, especially at night, are common. Round ligament pain. Sharp or dull pains on the sides of the abdomen may occur due to the stretching of the ligaments supporting the uterus. Hemorrhoids. Hemorrhoids may develop. Varicose veins. Varicose veins may appear. Swelling. Some swelling in the hands, feet, and ankles may occur. Dizziness. Dizziness may occur due to changes in circulation. Staying hydrated and avoiding standing for extended periods can help. Vaginal discharge. An increase in milky white vaginal discharge is normal. However, if the discharge is smelly, discolored, or accompanied by itching, consult a healthcare provider. Back pain. Back pain may develop due to the growing uterus and hormonal changes. Fetal development. The fetus undergoes significant development during the second trimester. 1. Physical features. The fetus develops more defined facial features, fingers, and toes. 1. By the 4th month, eyelids, eyebrows, eyelashes, nails, and hair appear. 2. Movement. The fetus begins to move, with initial movements described as flutters or butterflies. 2. These movements become more regular around 28 weeks. 2. The fetus can stretch, make faces, and suck its thumb. 3. Sensory development. Hearing. The baby's ears develop, and the fetus can hear sounds and respond to them, particularly the mother's voice. The baby's heart rate increases when listening to the mother's voice. Vision. By 16 weeks, the baby's eyes can see, and by 24 weeks, the baby can see a lot of things. A spotlight on the mother's abdomen may cause the baby to move. The baby can distinguish between daytime and nighttime. 4. Size and weight. By the end of the first trimester, the fetus is about 5 inches long and weighs about 50 grams. By the end of the second trimester, the fetus is about 10-14 inches long and weighs about 1 kilogram. Tests and screenings. Several tests and screenings are typically performed during the second trimester. 1. Ultrasound. An ultrasound is performed to check the fetal anatomy. 1. The sex of the baby may also be determined. 2. Gestational diabetes screening. Screening for gestational diabetes is typically done between 24-28 weeks. 3. Rh factor. Checking for Rh factor is done. 4. Complete blood count, CBC. A CBC is done to check for anemia. 5. Syphilis rescreening. Rescreening for syphilis is done. Precautions and what to do. To stay healthy during the second trimester, it's important to follow certain guidelines. 1. Maintain a healthy lifestyle. Engage in regular exercise, such as walking and swimming, about 20 minutes per day, and eat a nutritious diet. 1. Continue taking prenatal vitamins. 2. Avoid certain foods. Avoid raw or undercooked meats, unpasteurized dairy, deli meats, and fish high in mercury. 3. Avoid harmful substances. Refrain from smoking, drinking alcohol, and using recreational drugs. 4. Other things to avoid. Avoid cleaning a cat litter box due to risk of toxoplasmosis. Avoid hot tubs and saunas. Avoid lying on your back for extended periods. Sleep on your side. 5. Dental care. Maintain good dental hygiene by brushing, flossing, and rinsing your mouth after every meal. 5. Regular dental checkups are important. 6. Stay hydrated. Drink plenty of fluids throughout the day. 7. Manage discomfort. Leg cramps. Stretch calf muscles before bed and stay active. Nasal congestion. Use saline drops or a humidifier and apply petroleum jelly to the nostrils. Back pain. Wear comfortable, low-heeled shoes. A pregnancy tummy supporter or hot, cold packs can also help with back pain. 8. Swollen legs. Elevate your feet and consider wearing compression stockings. Emotional and mental well-being. The second trimester may bring a renewed sense of well-being and increased energy. It's a good time to prepare for the baby by 1. Taking childbirth classes. Look into childbirth classes and learn about the different types of birth. 2. Making a birth plan. Discuss birth options, including vaginal birth, assisted delivery, and C-section. 3. Learning about breastfeeding and parenting. Read and take classes to prepare for your new role as a parent. 4. Choosing a pediatrician. Select a pediatrician for the baby. 5. Other activities. Tour the hospital where you will give birth. Start doing pelvic floor exercises. Consider using a meditation app. 6. Addressing anxiety. If you feel anxious, learn more about labor and delivery. 6. Try to make healthy choices to give your baby the best start. When to call your healthcare provider. It's important to contact your healthcare provider if you experience any of the following. 1. Unusual or severe abdominal pain or cramping. 2. Vaginal bleeding. 3. Difficulty breathing. 4. Signs of premature labor, including regular contractions, fluid leakage. 5. One leg is swollen and the other isn't, as this may be a sign of a blood clot. 6. Strong urge to urinate, pain when urinating, urine that is cloudy, fever, or backache, as this may be a sign of a UTI. Additional tips. 1. Consider getting new underwear that fits well and makes you feel good. 2. Use panty liners. 3. Start moisturizing your body early to help with potential stretch marks. 4. Look into perineum stretching for the third trimester. 5. A pregnancy pillow can enhance comfort. 6. Stop over Googling pregnancy symptoms to prevent unnecessary anxiety. 7. Don't ask for too much advice from others, as this may confuse you. 8. Consider wearing maternity clothes to feel more pregnant. The second trimester is generally a more comfortable time in pregnancy. Enjoy this period by eating well and staying active.